No matter what age or physical ability, injuries can happen, and the team at Holston Medical Group can help you get back to your favorite physical activity. Doctors Lindsay, Remy, and Ashraf Youssef are both here from the HMG Orthopedics and Sports Medicine Group. Thank you both so much for being here. We really appreciate it.
Thank you for having us.
Yeah, of course. So, Dr. Remy, I'm going to start with you.
Yeah.
You are a surgical, I want to make sure I get this right, surgical sports medicine physician. What exactly does that mean? What kind of conditions do you treat?
Yeah, I'm an orthopedic surgeon, and I did my fellowship training in sports medicine. So basically that means I take care of athletes of all ages and abilities, whether they got hurt on the field, at the gym, or just even in their day-to-day life. So some examples of common things I treat would be injuries of the hip, knee, ankle, shoulder. For example, an ACL tear in the knee or a rotator cuff tear in the shoulder.
Right.
While I focus on the surgical side of things, I work closely with two colleagues, Dr. Campbell and Dr. Schaefer, who focus on the non-surgical care of the exact same types of injuries. And by working together, we're really able to offer the best, most advanced treatments to help get our athletes back in the game quickly and safely.
Right, kind of like a whole group kind of aspect, a team approach to trying to get them out doing their favorite physical activity or sport, right?
Yes.
So are there any treatments that you use or any treatment methods that you use to maybe speed up the recovery process?
Yeah, so one of the wonderful things about Holston Medical Group is we do have this great full spectrum team that's able to offer all the latest technologies. So everything from ultrasound guided injections to cutting edge physical therapy techniques such as blood flow restriction therapy to minimally invasive arthroscopic surgeries. We offer the full spectrum of care.
Wow, that's wonderful. And what's great too is when people come into your group, you can really find out what's best for them, the best treatment plan, right?
And really individualize it to the patient.
Yeah, exactly. And so, you know, we talk a lot about how you guys deal with a lot of athletes, but you deal a lot with, you know, not so much athletes, you deal with people who are just active in their everyday life as well.
Yeah.
But you work with a lot of sports teams in the area, right?
I do. I really love taking care of athletes at, you know, yes, it includes all ages, but the young athletes are particularly fun because they're so motivated to get back to play. So I'm the team physician for the Gate City High School football team as well as the Kingsport Mets.
Very cool.
And in that role, I work with the coaches, the athletic trainers, even parents and the athletes themselves to help address injuries when they occur and also to help educate towards injury prevention. And I got a lot of really unique experience in that role. When I was a fellow, I was able to work with the Baltimore Ravens and the Washington Wizards.
That is really cool, very cool. So you have a great experience with just a lot of different teams. And so, Dr. Youssef, I now want to talk with you.
Sure.
You kind of focus more on hands and upper extremities, right?
Correct.
Yeah, and so what kind of conditions do you deal with a lot?
So I'm an orthopedic surgeon as well, and you know, my focus is really shoulder to fingertips, so hand, wrist, elbow, shoulders. A lot of the common conditions that I treat are carpal tunnel, trigger fingers. I also, like Dr. Remy, treat rotator cuff injuries, but also really in the upper extremity, any tendon, bone, or nerve problem in the upper extremity. I treat, and the great thing is, you know, in the upper extremity, a lot of things can be treated with or without surgery. So as an upper extremity surgeon, I really focus on both.
Right, that's wonderful. And I mean, if you think about it, you use your arms, your wrists, your fingers every day, almost every minute of every day. And so you working with hands, it can be very debilitating when you see someone with an injury, you know, and you really realize how often you use your fingers or your wrist or anything like that. When should people seek treatment? When they start feeling something? I mean, you know, it's such a hard thing to kind of explain.
I'm glad you brought that up because that's one thing I see a lot is a lot of people wait so long to come in and see me. And really, if you're having any pain or any difficulty using your hand, you should come in and be evaluated because there's so many things in hand and upper extremity that can be treated so easily. Many of the things, like I said earlier, many things can even be treated without surgery. There are injections, there's therapy, there's bracing that can get you back doing the things you want and need to do without pain or difficulty like you were having before.
Right.
And I'd say one of the most common things that people say to me, especially after something like a carpal tunnel or something, and they all say, oh my gosh, why didn't I get this done sooner? And so it doesn't hurt to come in, get evaluated, at least know what your options are. And find a treatment that works for you.
Exactly, and you just made a great point, is that just come in and talk to you guys, right? Because it can really make a world of difference and make your life a little easier and less painful, right? Well, we really appreciate both of you coming in and talking to us. Great getting to know you both. And if you want to make an appointment with the HMG Orthopedics group, make sure you give them a call. All of their information is right there on your screen. They're located in Kingsport. You can also go to holstonmedicalgroup.com for more information.
The preceding portion of Daytime Tri-Cities was sponsored